Alright, so today we're gonna discuss about a condition or a clinical scenario where the doctor or your nurse or your critical care specialist or your physician, your surgeon comes and tells you that your patient is critically ill or is very serious, is in the ICU, is serious, or the condition is very ill, very bad. So, what does it actually mean? What does it mean that the patient is critically ill or serious? So, how a doctor or a healthcare professional comes to a conclusion that the patient is critically ill or not? Okay, so that's what we're going to discuss in this video. So, let's find out. Okay, so first thing first, we are actually going to see the function of the heart because it's very, very important. There are multiple factors in which we can decide that the patient can actually deteriorate very fast or the patient is not critically stable. Okay, so one of the very important key factor is the functioning of the heart and the general condition of the heart. Now, whenever we talk about the heart, we have to know the function of the heart and how is the heart functioning. Like is the ejection fraction is adequate or not, the pumping ability of the heart is adequate or not, or the heart is pumping properly or not. What is the number of heartbeats per minute? Is it normal rhythm or the rhythm is abnormal? Or what is the blood pressure of the patient, or is there any ECG changes, or there's any shortness of breath, or how is the pulse? The volume is low, the volume is high, there's irregular pulse, regular pulse, delayed pulse. So these are the things in which we can know the basic functioning of the heart. Along with this, whenever the patient is going for a surgery or after a surgery or after any condition which is the patient is admitted in the hospital, we also do a treadmill test in which we allow the patient to walk for 6 minutes and we see for the changes in the heart. And sometimes most of the patient who are fine, who are normal, they will be able to walk easily, but sometimes the patient is very weak, is having very low heart functioning. In that cases, the patient is not able to walk for 6 minutes. Also, the patient may be able to walk for 2, 3, 4, 5 minutes, or sometimes 1 minute, and the condition becomes very worse. The patient is having shortness of breath, difficulty in talking. He's gasping for air, and these things will tell that okay, the basic functioning of the heart is not fine. Because whenever you have a surgery or you're having pain or you are in the ICU or you're in the hospital, you're generally ill, your heart is working more than normal. Whatever your heart is working right now, the function of the heart, the demand of the heart goes more than normal whenever you are in the ICU or you're in the hospital or you're sick or you are having a surgery or you are having post surgery or you have any kind of injuries, because the function of the heart is the demand goes up, right? Along with this, we will also do something known as echocardiography, in which it is actually 2D echocardiography. We will see the valves of the heart. How is the valve leaking, how is it functioning, what is the amount of preload, afterload, and overall structure of the heart. We'll try to find out what is the problem in the heart in the first place. Okay, so these two tests are very, very important: 6 minute walk and your echocardiography. Along with obviously pulse, ECG, and blood pressure, we'll get to know what is the function of the heart. If the heart is perfectly fine, you are having very good chance of recovering very, very faster, right? This second thing. Oh, okay, so whenever we talk about heart and we're having a shortness of breath, we have NYHA, New York Heart Association classification. So we classify the patient on the basis of class 1, 2, 3, 4. Okay, so see here, class 1 is no limitation, you're normal, absolutely fine. Class 2, slight limitation of the physical activity. Okay, comfortable at rest, but ordinary physical activity results in fatigue. Now try to understand here. Let's say I'm, whatever is my age or my sex, whatever is my, if I'm male, if I'm 24, 25, so if I'm walking with my colleagues or my same gender, I get tired. So my friends are not tired, but I'm getting tired. So yes, it is a sign that I can put this in class 2, because in your same age group and your same gender, you're getting tired doing the same activity which your friend is not getting tired. So in that case, you'll put this in class 2. Class 3, yes, okay, mark limitation and you are comfortable rest, but any amount of slight to moderate work also it gets you tasking. Even if you need to climb first floor, you are getting fatigue, you're sweating, you need to take a rest or something. And class 4 is sorry, beg your pardon, class 3 is that, and class 4 is, it's very, very severe. Even if you're not doing anything, you're having symptoms, you're having shortness of breath, you're having tired. Even if you're not doing anything, you're sitting in the bed, you're not able to do your stuff. What you're not able to do your stuff is normal. day-to-day activities. That means you're not able to take a shower, you're not able to eat yourself, you're not able to use a washroom. So this all thing will cause you, put you in the class of class 4, right? Once this thing is done, we also see for the lung function. So first thing we have checked for the heart function, and how we check out the heart function. Now we're going to see your lung function, which is very, 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 very important. Oh my god, everybody has to drive today. Okay, so whenever you are doing for the lung function, please try to appreciate that a normal adult will be having a respiratory cycle of around 12 to 20 per minute. Average is around 16 beats per 16 respiration per minute. Okay, but this will go up if you're having pain. Definitely, man, if you're having pain, this respiratory rate will go up to 25, 30 also. Or if you're having fever, obviously it's going to go up. If you're having any kind of infection, it will go up. And if you're having pneumonia, any lung pathologies, this will go up, because your body will try to compensate it. Because if let's say one of my lung is completely damaged, so the work of two lungs has to be compensated by one lung. So obviously respiratory rate will go up. So it's a compensation mechanism, right? If you're having pain, you're going to breathe very, very, very fast. So if you're breathing very, very fast, it itself causes you into very big trouble. So if you're breathing very fast, you're throwing out a lot of carbon dioxide. If you're throwing a lot of carbon dioxide, you're throwing out the air, the carbon dioxide will go, and you'll go in respiratory alkalosis. The pH will go up, right? And acidosis. So whenever you're having respiratory issue, the metabolic issue will metabolic compensation will take place. Whenever having metabolic issue, the respiratory compensation will take place, right? So if you're throwing out a lot of carbon dioxide out, that means there's reduced carbon dioxide, you're going in respiratory alkalosis. Okay, now this thing is done. So now in order to know the functioning of the lungs, you want to do something called as pulmonary function test. Okay, in this I think you guys saw this in hospitals, very commonly done, spirometry. In this you will be instructed by your nurse or the technician how to perform this test. You're going to breathe as fast as possible, and you're going to take a deep breath and breathe as fast as possible and as much as you can. It's going to tell you the overall functioning of your lungs. Very, very, very important. It gives you a basic idea of the how is your lungs, what is the capacity of the lungs, what is the extra capacity of lungs, what is the tidal volume, what is the normal rate, what is the amount of pressure that your lungs can generate in 1 second. So this is what this will give you. You can get the graph and can interpret the value. Okay, this will tell you what is the functioning of your lungs. Okay, and also before any OT or any major surgery or just after surgery, we tell the patient to do chest physiotherapy along with this spirometry exercise. So you're going to breathe in this, and all these balls are, and it's kind of different weight. So what you want to do is that you want to blow out and try to keep these balls elevated for a certain amount of time. Sometimes the balls itself are heavy, or you just want to keep all these three balls elevated up for a certain amount of time. So you have to do it multiple times a day. The more you do, more good for you. Okay, but give a gap of cycle, like do 5 cycles and stop, and again after some time do 5 cycles, some after that 5 cycles. So you're supposed to do like that. It is going to make your lungs stronger. It's going to reduce the chance of going in lung collapse. Okay, respiratory failure chances will come down if you're practicing this thing. So before, sometimes if the patient is very old and very weak, and we see the patient is not very fit for the surgery, before that we start this chest physiotherapy and lung exercises before the surgery itself, because we don't want you to go in lung collapse during the surgery or post surgery. Okay, once this thing is done, we have done your heart functioning, you've done your lung functioning. Now we come for your kidney and liver function, because see, whenever you're in the OT, whenever you're in the ICU, a lot of amount of drugs have been given, a lot amount from your drugs to stop your vomiting, from your drugs to reduce your acid production, from your drugs to increase your heart rate, reduce your heart rate, or to give a pain management. A huge amount of drugs have been used. So all these drugs mostly have been thrown out by the kidneys, and some are being thrown out by your liver. So liver and kidneys functioning has to be very, 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 very important. Okay, so if your kidney function is very good, definitely the chances of survival and chances of improvement is very, very fast. So whenever you do a kidney function test, you are going to take out the blood sample and see for the kidney function test. In this, you are going to specifically more focus on this creatinine. Obviously in males it will be a little bit higher, because males are having more amount of muscle mass. More amount of muscle mass means more damage. So whenever what is the basic principle of this creatinine? Because see, creatinine is a toxic material and it's been thrown out by the kidney. So okay, whenever the muscles has been broken down, the kidney is filtering it out and throwing it out of the body. Now if the kidney is not working fine, so the whatever the amount of creatinine should be thrown out of the body by the kidney is not being thrown out. So slowly the creatinine level in the blood is going to rise up. So whenever it is going to rise up, whenever you're going to pull out the blood and we are going to measure the creatinine in the blood, we will see it's an elevated range. Okay, and please make sure that creatinine is very sensitive. Okay, so if someone is having 1.3 and someone is having 1.5, still it's significant. It's not just zero point 0.2 or zero point 0.3 or just one different. It's very significant. If I'm having creatine creatinine value of around 1, and let's say you're having creatinine value of 2, and you might think, okay, the value is just around 1 different. It's significant. It's very significant, right? Along with this, you want to see for the uric acid. What is the uric acid seen in there? You have to see the albumin and globulin ratio, because see, your kidneys are designed in such a way that whatever the proteins in your body is there, it's never ever going to come out from your urine. It should not come out. Okay, if the kidney is not working perfectly fine, all these proteins will come out in your urine. So whenever you see the urine, you'll be able to see the urine will be frothy. A lot of froth like material will be seen in the urine. So that's a very red sign that why you're having froth in your bubbles and froth in your urine. Just to give you an example, whenever you beat your eggs, like whenever you stir your eggs to make an omelette or something, you can see the bubbles and multiple bubble like material form in the omelette. So same thing happens whenever, because the egg is made up of albumin, right? So this is very important. And then you have to see the creatinine clearance ratio, and you have to see the 24-hour urine output. Very important. If a kidney is bad, you're not going to produce enough urine. Okay, and also sometimes if you're having chronic kidney disease, you will be having less amount of hemoglobin in your blood. Okay, so sometimes if you're having anemia for unknown reason, we do not know, we have ruled out everything we have ruled out. Okay, there's no bleeding, there's no nutritional deficiency, there's no worm infestation, there is no nothing, then we have to see for the kidney also, because if you're having kidney issues, you will be having less amount of urine. Okay, and also potassium is regulated by the kidney. It's very important. If the potassium ratio goes ups and down, your heart rate will the rhythm of your heart will be disturbed, because you can go in diastolic arrest, and it's very significant, potassium. Now once we have done your heart, we have done your liver, we have done your kidney, and we have done your lungs. Now we're going to focus on the liver. Okay, now liver is very important. Again, as I told you, all the drugs will be thrown out by the liver. So you have to see the total bilirubin level. What is the total bilirubin level? You will be able to see the direct and indirect. Okay, so direct plus indirect will give you total bilirubin level. Okay, so if the bilirubin level is high, that means you'll say that you're having jaundice. And remember, jaundice is never a diagnosis. Okay, I can have jaundice, but you cannot say I'm having jaundice. You have to say I'm having jaundice because of XYZ, something. I'm having jaundice because of stone, or I'm having congestive heart failure. You cannot say I'm having congestive heart failure. Congestive heart failure is never a diagnosis. You have to say why am I having congestive heart failure, right? Once this thing is done, you're going to see for the AST, ALT, because whenever you're having liver damage, this ALT and AST values will go up. This is very important. Okay, because these are present in hepatocytes. Whenever the liver is been damaged, these cells have been damaged, this will elevate in your blood. Okay, along with this, you have to see the albumin and globulin ratio is very important also, and the protein, because your liver is making protein. All the protein function is done by liver. If you're having less amount of protein, almost every structure of your body is made up of protein. Your immune system is made up of protein. So if you're losing protein, your immune system is going down, and you will have more chance of having infection. Okay, along with this prothrombin time, very important is that, because your liver is very important for coagulating, making coagulation of blood and making clotting factors. If this has been rearranged, definitely you'll be having more amount of bleeding, more amount of taking more time of BT and CT. Okay, I'll make in a second part of this.